I suppose about half the patients who have pancreatic cancer would at some stage through their disease have a course of radiation therapy. And those patients we tend to use it in are patients that might have pain due to the tumour pressing on nerves that are around the pancreas, and so radiation is very effective in reducing their pain requirements. It's also very good for helping stopping the tumour from pressing on the small bowel that's next to the pancreas, and so patients more likely to be able to eat normally after treatment. And it's also good that sometimes these tumours can bleed, and radiation is very good to stopping any form of bleeding from the bowel.
When I was diagnosed with the recurrence in the lymph node, I had surgery for that. I was only in hospital for a short time, but having recovered from that about 6 or 7 weeks from that surgery, I was put on a program of radiation therapy and chemotherapy.
Sometimes radiation can be used with a combination of chemotherapy, and the radiation is to treat the local tumour that's confined to the pancreas, and the chemotherapy is to work elsewhere in the body to remove any cells that may have potentially spread beyond that radiation field. So basically, we use radiation treatment in all different scenarios with pancreatic cancer. So sometimes if a patient's had an operation, they've been able to remove the tumour if it's localised. We use radiation to mop up any cancer cells that might be left behind. Either that can be seen on a pathology report if the tumour comes up against the edge of the specimen, or if they've got lymph nodes involved, we sometimes would recommend a 5-week course of radiation with chemotherapy. Sometimes the tumour is wrapping around blood vessels in the area and the surgeon can't remove it safely, so we'd use radiation to treat the local tumour, either a long course if the cancer hadn't spread beyond the pancreas, or a shorter course if we want to just get help a person's symptoms if it has spread elsewhere around the body. Yeah, so basically people are usually referred from the medical oncologist or the surgeon who they've first seen. That first consultation is really getting to know the radiation oncologist. They can learn about your past history and see whether it's appropriate or not that radiotherapy should be used. If it is appropriate, the next visit is usually called what we call a planning appointment. Now that's where we plan the radiation. That involves in most times a CT scan with you in the treatment position. And that's very important. So basically by doing that CT, we get a perfect outline of you in the treatment position, and so we can target the radiation beams to treat the local tumour within the pancreas and avoid treating the normal tissues around the edges. That appointment usually takes about 30 minutes, and we do leave what's called a tattoo. Now that can sound horrific, but it's basically a tiny little pinprick under the skin, and that's so that every time when you come in for your radiation treatment, we can set you up in exactly the same position, and you can shower normally through your treatment on a daily basis. Once that CT scan's been done, the radiation oncologists and the radiation therapists, who are the technicians who help us with your treatment and will deliver your treatment, we spend about the next week marking on carefully where the tumour is and designing beams to come in and treat that tumour. And so usually starting, I think, from 1 to 2 weeks after that planning appointment.
So I was having radiation therapy every day for a period of 7 weeks, 5 days a week, and once a week I was having chemotherapy treatment. And the chemotherapy that I was having was only 1/10 of the normal dosage, but it was only meant to supplement the radiation therapy. It wasn't a full treatment of chemotherapy. In my case, the oncologist and the surgeon considered it only necessary to supplement the radiation therapy. That was the primary treatment.
The scheduling that we use really depends on, as I said, each individual case. Sometimes it's a 5-week course of treatment, and treatment goes from Monday to Friday, and each treatment takes about 15 minutes a day, and most of that time is in setting up a patient in the correct position, and the beam's only on for a couple of minutes. Basically, the beam is painless, you can't feel anything. And it's very important to know that you're not radioactive. So most patients, it is outpatient treatment, so there's no special precautions that you need to take. Once the beam's off, there's no radiation, so you can go out and interact with the family and the community as normal.
It took me a long time to recover from the radiation therapy as far as my digestion. I was having continual problems with diarrhoea, and I've only just recently, in the last 6 months, overcome that with just diet mainly and proprietary medications. I don't have to have any prescribed medications.
In terms of side effects of treatment, again, because it depends on where the radiation oncologist is targeting the beam, but most of the time with pancreatic cancer we'll be treating in the abdomen area. The common side effects are tiredness to the point where you might want to go to bed a bit earlier, and then all the other side effects are very much localised to the area where the beam's being targeted. So some people can get some nausea, diarrhoea, but that's less common. And usually some mild redness of the skin. It's very uncommon to need to come into hospital because of side effects from this sort of treatment. And it's very important to know that each person's case, their treatment's individualised. So sometimes radiation won't be appropriate, and in other cases it will be. And that's very much focused on that particular patient's needs and taking into account also their previous medical history.